Interpreting and comprehension practice. For the last 3 days, after I visited a horse farm, my eyes have been really itchy and watery. My nose won't stop running, and I keep sneezing throughout the day. I've also noticed a light rash on my arms and neck that comes and goes.
Provider. Response. This looks like a seasonal allergic rhinitis. We'll start you on a daily antihistamine and a nasal steroid spray to reduce inflammation and control symptoms.
About 20 minutes after eating shrimp, my throat started feeling tight, and it became hard to breathe. My lips and tongue felt swollen, and I got really dizzy. I felt like I might pass out.
Provider. Response. You're experiencing anaphylaxis, which is a life-threatening allergic reaction. We're giving you epinephrine right now, along with oxygen and IV medications, and we'll monitor you closely.
I've had this cough for over a month, and it just won't go away. I wake up at night drenched in sweat, even when the room isn't hot. I've lost about 10 pounds without trying, and sometimes I cough up a little blood.
Provider. Response. Your symptoms are concerning for active tuberculosis. We'll do a chest x-ray and sputum tests, and if TB is confirmed, you'll need long-term antibiotics and follow up with public health.
Four, influenza, flu, patient symptoms, patient voice. I suddenly started feeling sick 2 days ago with chills and a high fever. My whole body aches and I feel extremely tired. I also have a dry cough and a bad headache.
Provider. Response. This sounds like influenza. Since your symptoms started recently, we can begin antiviral medication and recommend rest, fluids, and fever medication for comfort.
Five, acute bronchitis patient, symptoms, patient voice. After I had a cold last week, I started coughing a lot, and now it's bringing up mucus. My chest feels sore when I cough. I get a little short of breath, especially when I'm moving around.
You likely have acute bronchitis, which is usually caused by a virus. Antibiotics aren't needed. But we'll focus on relieving your symptoms with cough medicine, fluids, and possibly an inhaler.
Six, pneumonia patient, symptoms, patient voice. For the past 4 days, I've had a fever and chills that won't go away. I'm coughing up thick mucus and it's hard to catch my breath. It hurts in my chest when I take a deep breath.
Your symptoms are consistent with pneumonia. We'll start antibiotics, get a chest x-ray, and monitor your oxygen levels to decide whether you need to stay in the hospital.